Time of the morning for our Health Watch, where we talk about all the topics trending in the medical world.
As always, we're joined by Dr. Syed Hussain of Trinity Health of New England, and it is Skin Cancer Awareness Month. And this morning, we're following up on the use of sunscreen. And last week, we got a viewer email. A viewer sent us these pictures of his skin cancer. He worked outside for 30 years. He's had skin cancer 3 times. He went on to share about his experience with sunscreen. He's saying, I would put it on while working. I would sweat a lot and it would burn my eyes. I never reapplied it as we were sweating so much and couldn't stop working in the middle of the road to reapply. Now I'm paying the price. But also, I have read where the ingredients in sunscreen go right into the bloodstream, which isn't good either. So it's like you're damned if you do and you're damned if you don't. So Dr. Syed Hussain is here with us now. Is there a rule of thumb for people who are reapplying sunscreen when you're working outside? What would you say to our viewer here?
Good morning, Erica, and thanks to our viewer for submitting the question. My thoughts and best wishes are for that viewer in his or her journey towards good health. Now, a couple things. We do know that UVA and UVB rays from the sun are both cancer-causing and damaging to the skin in general. So it's really important that we do use sunscreen, SPF of 30 or more. For those individuals that are working outdoors, such as this viewer, for instance, it's important that you wear sun protective clothing as much as possible. And then you do apply sunscreen every 2 hours or so. There are 2 groups of sunscreens. One's chemical-based, the other is mineral-based. Mineral-based sunscreen, which contains either titanium or zinc oxide, may be less in terms of the side effect profile, in terms of irritability. So if you do have sensitive skin or your eyes burn, anything like that, then you may want to switch over to something that is more mineral-based to try it out. But, you know, the risks of not using sunscreen are definitely much, much higher than some of these pesky side effects.
Doctor, I took my almost 2-month-old godchildren to the beach over the weekend. When you look at sunscreen, there are so many choices. You touched upon it a little bit there, but are there specific chemicals in options that we should avoid?
You know, there are, without getting into too much detail here, there are ingredients that the FDA has looked into, oxybenzone, for instance, but there is not enough evidence to say, okay, these are now banned or can't be used at all. There is some debate and discussion. Europe, for instance, has a little bit of a higher bar in terms of how much quantity of these ingredients can be used. We don't have that, and FDA continues to look at what is being used. But suffice to say, the mineral-based sunscreens are the safest and most effective per the FDA.
All right, Dr. Hussain, thanks so much. Now, let's go from sun to sleep. Something that's really interesting here. A new study found a possible connection between nightmares and autoimmune diseases. Researchers found that 60% of lupus patients had increasingly vivid and distressing nightmares. Could this be used as a warning sign? This is something that I guess people who are experiencing nightmares on a regular basis, maybe they should think about. Maybe this is something bigger than just a nightmare.
Yeah, Erica, this is very interesting. This is a new study out this week emanating from the University of Cambridge in the United Kingdom. And basically, folks that had very vivid nightmares, sometimes even progressing into daytime on a consistent basis, may be linked to the onset of autoimmune disease such as lupus, rheumatoid arthritis, systemic sclerosis. We know, for instance, lupus definitely impacts a lot of different organs in the body, including the brain. And this may be a sign where we may be able to use nightmares, especially in patients who have underlying lupus or an autoimmune disorder, to predict whether they're going to have a flare-up. We have other things that we look at, such as protein in urine or rashes, skin rashes, for instance, to determine whether a patient is going to get a flare. But this may add to that constellation of symptoms to look out for so that those people can be started on treatment. Now, I do want to point out, there's no cause for worry if you do have an occasional nightmare. We all do. It's normal. It's in those individuals that have a very vivid and sustained pattern of nightmares, and you should discuss that. Don't hesitate, but please discuss that with your provider if that applies to you.
Yeah, and we talk a lot about sleep here on the morning show. Curious if not sleeping well can potentially worsen chronic conditions and mental health. I suspect yes, but what do you say?
100%, Keith. And we've discussed this in the past on Health Watch. It's really, really important that you get those, 7 to 8 hours of sleep on a daily basis. We do know lack of sleep is related to chronic health conditions as well.
Now, while we're on the topic of sleep, I think this is maybe more of a personal question from me and Keith. What are your quick and dirty tips for getting more sleep and for falling asleep faster and staying asleep longer?
It varies from individual to individual. There are things that people may do nighttime to, turn those phones off or stop looking at work emails, things that may calm and soothe, so that you get into that habit of going to sleep. And, cell phones are everywhere. Social media is everywhere. And there's a really bad habit of, if you do wake up, you try to grab your phone, get out of that habit, try to focus on going back to sleep, things like that, little things like that, Erica, is what I would suggest.
Yeah, I feel like grabbing your phone in the middle of the night when you can't sleep is the worst thing to do.
Right. Dr. Hussain, recently recognized for his excellence in his field. Congratulations on that, my friend. As always, we are grateful you're joining us right here in the morning show. Take care.
Thank you, Dr. Hussain.
Thank you.